as you talk about people who will lose their health care access, for your own constituents who will lose access to Medicaid, what can you do for them? And have you been in touch with California Governor Gavin Newsom about helping this population?
Yeah, we've been talking to the governor and his team now for months. As soon as we saw, what they were proposing, what I'll tell you is that Medicaid is getting all the attention, but it's not just about Medicaid. So there are real cuts, and they claim that it's just work requirements. But the Kaiser Family Foundation came out with an analysis that said 92% of the people who are going to be kicked off the rolls are people who are eligible for the care but don't meet the new bureaucratic red tape. We know that when similar requirements were put in place in Arkansas and other states, that was, exactly what happened. People who were eligible for the care who just did not fill out the paperwork properly or did not get through the bureaucratic hurdles. So you will have people who deserve and need the help who aren't going to get it. But it's also about the Affordable Care Act, because they're taking away the, all the progress that we made during COVID, when we passed something called the American Rescue Plan. We put in place policies to reduce the cost of premiums for people trying to get their care through the Affordable Care Act exchanges. This bill, the big ugly bill, as I call it, the Republican budget, undoes that. So immediately, the Affordable Care Act becomes a lot more expensive for people. So the independent estimates are that millions will be kicked off ACA, millions more will be kicked off Medicaid. But then it's also about Medicare. Because of that massive debt bomb that this is, the multi-trillion-dollar addition of the debt, that then triggers another $500 billion in mandatory cuts to Medicare. That means doctors will get paid less. That means patient care will decline in quality. And then the last thing is this issue of the provider tax. So in California and a lot of other states, the way Medicaid is funded is through a provider tax on hospitals and healthcare providers. The Republican budget bill decimates the ability to collect those same level of provider taxes, meaning you could have hospitals that shut down. And, we talked a lot about rural hospitals, but it's not just rural hospitals. It's suburban, it's urban. All hospitals that have a Medicaid population will be cut. And if you are on private insurance, if you don't have good hospital coverage, that impacts you. So it literally impacts every single person in America who has health insurance will be impacted by this bill in a negative way over time. And that is a massive failure by this administration, particularly when the president said that he would protect Medicare and Medicaid. He's doing the opposite with this.